As I understand it, people with a serious mental illness have a life expectancy gap of between 20 and 25 years to the main population. In other words, they live less, 20 to 25 years less, and have very significantly higher experiences of diabetes, heart disease and stroke. Just how serious is this? Is this the group with the highest degree of illness in our society?
Well, I'm not sure it's the highest degree of physical illness, but it's certainly on par with those from Indigenous populations and other high-risk populations. In fact, we should have a new risk category in all the cardiovascular textbooks for doctors, which says those with mental illness. So it's a real problem.
In a nutshell, why is the gap so significant?
Well, firstly, the physical illness is an accompaniment of mental illness, schizophrenia, bipolar. It's probably because there's a genetic a shared risk, I guess, but also then it's lifestyle. It's then the medications that partly contribute to it. But the major problem exists is not because the illness is untreatable, it's just not being treated. It's really one of preventable cardiovascular death that is leading to premature death. In other words, we're just not doing the job of picking it up.
At Concord in Sydney, in partnership with Diabetes Australia, you've been working with 3 groups of 10 people with serious mental illness to see what you can do to improve physical health. You were able to significantly improve people's health. What did you do, and what are the lessons that all health professionals can learn from it?
Well, the key here is that what can we do that's cheap and therefore can be done by public services under stress? So we went out and spent $128, I think, on a medicine ball and bits and pieces, and had a very simple exercise program which we had young people come back, and we also gave them diet advice, but it's done in a non-preaching way. It was part of the group process. It was a lot of fun for people, and it wasn't in a gym, so there was no expense. It was just wherever you are, any person can do it, and we were quite amazed that in just 12 weeks we can drop people's cardiovascular risks very significantly. In fact, so surprising that when we did it next time we were surprised again. It works and it's cheap. All it requires is someone to have the sort of willpower to help people get to exercise.
So there's 2 elements there. It's helping people get to it, and then it's the group process. Do we have any questions or comments about peer group activity to improve health, or something else from our online people?
Conrad has sent us a message from home saying he joined a wheelchair basketball group and also started walking 4 kilometres a day, and he found that was a good solution for him, was joining that group. Pat said that she found the same thing as Juanita, that the GP was ignoring her physical symptoms and putting them down to anxiety and other symptoms of her mental illness, even though she was actually then diagnosed with a physical illness. Sharon was also concerned that people with schizophrenia are not listened to properly. People who are not listening to their voices when they have concerns about their physical illness.
What we've been able to do with the Bulldogs Club is enter a partnership. They have a spectacular gym. They're running a program for our consumers in partnership with ourselves and a community health service, where they open the gym up, design exercise programs for people, help them with their diet and help them lose weight. But the really powerful part of this program's been going for about 18 months. Nearly 2/3 of the people who joined the program, who were there to improve their physical health, have now got jobs. And that is something that was impossible. A lot of these people had never worked, and they've now got jobs, and they're physically healthy.
What are we going to do about poverty? Because poverty's bad for health too. It's very hard to eat fresh fruit and vegetables if you're on a disability pension. How did they get jobs?
Their self-esteem improvement. I mean, I think the first thing, I'm not overweight, but as Tim will tell us, the issue is what's here. I'm too big here.
Around the belly?
Around the belly. So I need to reduce my waist measurement. If I did, I'd feel a bit better. These people did significant reduction. They felt substantially better. They were with their peers on a regular basis. They were going to the gym 2-3 times a week. Relationships formed, their confidence improved. They were then assisted through the community health service to apply for jobs, and they got those jobs.
So partnerships with sporting organisations that can be about relationships and exercise, but also a lot more. You've got something called the Mental Health Sports Network.
It's been going as a loose association in New South Wales for about 20 years. They came to the fellowship and asked us to take it over. We now have 5 other non-government organisations, New South Wales Sport and Rec and New South Wales Help, as foundation partners. With any exercise, I can go out and play touch football tomorrow and I'll do it for an hour and that'll be the end of it. The beauty of this is that it's competition and people want to win. We all want to win, so they'll prepare for the competition. That's ongoing exercise. That's focusing the person's attention on their health, not just for the 1 hour's activity, but to improve so that they can do well in the 1 hour's activity. New Moves is a program that's been developed within the fellowship, and it's again a program that's based around diet, weight control, trying to get the person back in control. One of the things Juanita said, which is critically important, is the person being able to take control themselves. We all have GPs who don't necessarily listen to what we say, and as Tim was saying, we've got to tell them what to do. So New Moves is another one of those programs that helps the person take control.
Some of the issues that we've focused on is there's some really fundamental changes, because there has been an assumption that health is not really important for people's mental health, and it's not an essential issue. So I suppose our theme for this week is In It Together. We need to change the health of people with mental illness. In that regard, we need to change the environments in which they are in, and we need to change the way we work with people with mental illness, and that's been some of the issues we've seen as really important. In terms of environments, we need to be able to open up opportunities for people to do physical health activities and feel welcome and engaged. And also we've been doing some training of our staff, and we've engaged carers in those activities and run training for carers at the same time.
Carers can do a lot to help to create a different environment, and we as service providers, the people here who run various fellowships, there's a lot we can be doing in partnership with other agencies. It was lovely to hear the example before of thinking outside the square and saying that I could not get started on my physical health issues until we solved the problem of tidying up my flat. We need to be creative and thinking outside the square ourselves about where the triggers lie, and the triggers may not lie anywhere near our immediate physical health course. They may be another life factor. And then finally there's the individual themselves. I think Juanita was brilliant at that. You've got to become an empowered health consumer yourself.
So I've written all the sorts of things that I expected people would raise today about what improves your physical health: a good relationship with your general practitioner, a group to do your exercise with, do not smoke, monitoring of the risk factors, for example, overweight, eating too much, not moving enough, reviewing the medication, support from friends, peer support, move more, eat less, family and carer support, self-respect and advocacy for yourself. We've talked about social connection, we'll talk about work in a moment, friends, and raising physical health as an issue with your doctor.
We are literally all there we're being paid to provide you with services, and you've got to ask for them. You've got to say, I deserve as good physical health as anybody else.